For the introduction, and thanks for everybody for their time tonight and coming out. So I am Kate. I work in communications currently at Novo Nordisk, but I've spent about 15 years at different pharma companies in Canada. So I'm really excited to share with you a bit of a case study today in our obesity space. For those of you who know a little bit about Novo Nordisk or have heard or read anything about Novo Nordisk, we make about 50% of the world's insulin, and we have a huge amount of work that we research and study in the diabetes portfolio. So looking at my interesting fact about my grandmother, she is currently living with type 2 diabetes, and there is a possibility, or a large possibility, that many of you here are touched or impacted by diabetes, which is why working at a place like Novo Nordisk, doing such incredible research, is so rewarding for me. However, I'm not here to talk to you about diabetes today. I'm here to talk to you about how we leverage digital and social media at Novo Nordisk to do two things. One is to sell Health Canada approved treatments for obesity. And the second is how we also use digital and social media to talk about obesity and change people's opinions and perspectives about obesity in this Canadian market. So why is this interesting for pharmaceutical companies? Pharmaceutical companies are trying more and more to be more digitally savvy, but it's really challenging. Up until a few weeks ago, so this isn't months, this is weeks, we had a regulator who will be unnamed, who didn't even acknowledge the presence of social media in the rules and guidances that are given to pharmaceutical companies on how to market their products. So this is now only a few weeks in the making, and it's still in a draft version. So the rules that we do currently have also don't really lend themselves very well to getting sort of digitally or socially savvy. For example, I am forbidden by law to both say the name of my product and tell you what it's used for. So in a digital environment, imagine how challenging this is. Everybody would say, why are you being so, not telling us what this is for? We create an advertisement that says the name of our product, and we have a multitude of questions about the fact that we're not being transparent. Why won't you tell us what this is for? In fact, we are not allowed to tell you what it is for. We have to work in this way. So it is a real challenge for us to both follow the rules and to get into this environment where Canadians are accessing and getting information. But in the world of obesity, we have zero choice. Why? Because unlike other disease areas, such as diabetes, where my closest competitor would also have to follow the same rules that I do, in the obesity landscape, most of our competitors are not held to the same standards. So they can get to you on your way to this presentation, reflect on your journey in. How many of you saw, read, or heard something within your personal time getting here that was trying to sell you something for your weight, trying to convince you about something about your weight? So here we are now. As marketers, communications professionals, we're trying to get out in this environment. Now, here's our second challenge. In 2015, the Canadian Medical Association joined the World Health Organization and said, obesity is a chronic disease. So much like diabetes, it deserves the same type of research, treatment, and support as any other disease. Did you know I arrived here probably 2 hours early, not gonna lie? I sat in the Starbucks across the road. I sat there with my coffee, and I listened to somebody behind me talking to a friend about how her weight, she was so proud of her weight because she had enough willpower and energy to eat less and move more and lose weight. Did you know that this is not an effective treatment for weight loss? However, it is something that we all believe and hear and know. We celebrate those people who are successful, and we shame those who are not. And unfortunately, in an environment where this is a true fact, we unfortunately have to live with all this stigma associated with weight bias and stigma. So now, how do we do it? Case study. So how do we sell our Health Canada approved treatment for weight loss? I would really love to show you the ads. But unfortunately, as you know, I started this conversation talking to you about obesity, and guess what? My lawyers, who actually reviewed this presentation prior to me coming here, said that I wasn't allowed to show you the ads. because I can't assume that you're either a healthcare professional, that you have some type of background that would lend this type of message as being compliant. It would be a non-compliant thing to do. So what I'm gonna do is just kind of tell you about it. So we created a series of advertisements that were cleverly designed around a certain time of year. So for example, we're coming up to September. We did some advertisements that were like back to school, back to product name, looking at routine, trying to get just the product name in the hands and the eyes of the consumer, so that they could then take that information and do something else with it. We created a website, productname.ca. And then on that website, we said, talk to your doctor about this product. So instinctively, as general members of the public, we don't always assume that our physician is part of that conversation in terms of weight loss. Most of us believe or think that we have to do it ourselves. So even the very idea that your doctor's part of this trifecta, this conversation, is somewhat new. And then we provided people with a discount for the prescription. We developed these ads, we ran them through digital networks and channels, we created YouTube videos of the ad that we ran on YouTube, and then we targeted Canadians through promotional spend. During this time, we had a variety of different matrices, communications tools to respond to them when we heard or had any type of feedback. At that point, we also targeted physicians, because what you may not know, which is appalling, is that in medical school, doctors have about 1 hour of study dedicated to obesity. So much like all of us, our physicians also need to be educated. So all of these ads ran directed at consumers, directed at physicians, targeting Canadians that had an interest or shared interest in obesity. At the same time, we must do this too. We must help change people's opinions about what it means to live with obesity, so that when we talk about the name of our product, that message lands in a nice environment where people are open to listening to it and open to getting more information about the product, because they too buy into the fact that, wait a minute, my weight's not my fault. I need some help. And my doctor's part of that conversation. And I can get that help if I have a conversation with my doctor. However, not a lot of people believe this. And you yourself may reflect here on your own perspectives and your own bias, and think perhaps that you too may not have that same type of opinion. So what we do here is we run a whole bunch of third-party content. All of that third-party content is either driven from paid, earned, or owned perspectives, and it runs across different media channels. We look at targeting via the same kind of media spend that we did with our paid advertorial or paid promotion for our brand. And then we direct to different types of websites or expert content. So we look at the Canadian Obesity Network as a great place for people to go to learn more information. There's also another great website called My Weight, What to Know, also a really great resource for people. And all of this content runs alongside our branded advertising, so that in a compliant way, we can do both separately. So that's the end here today. I think if I can challenge you with anything, it's for you to put digital and social media for pharmaceuticals on your radar. Health Canada has now said, we have some guidance for you on how to do it. We need to get more savvy in this regard, and we need some support to do it. So think about our business, and also change some perspectives on obesity. I've become really passionate about this disease area, and I think if you or someone you know could benefit, it's worthwhile for yourself and for patients. Thank you.
So that's great. I'm a big fan of Saxenda. I think that, and I can say it because I'm not on your legal team, so Saxenda, I'm a big fan of it, and I agree with everything that you're saying. I think the sad part is that Dr. Google, does the government not understand that, you know, we're now 21 years into the digital age with search? Do they not understand that it is at the consumer's beck and call that all of this lives? So I'm going to ask the first question about regulation. Do you think that that's changing, or when do you think that will change?
No, I don't think it's changing, unfortunately. I think we have the rules in place to govern and keep Canadians safe from any kind of challenging messages that may come from pharmaceuticals, and I think the rules are here to stay. So it's just our smart brains that need to find cracks in the rocks in order to get the job done and meet consumers where they're at. And that is the best part of working in pharma. Because to be honest with you, who wants to work a job where there's a straight line? We love the dotted line. It's so fun to figure this out. This is such a nut to crack. And I think if people can do it, that is a real opportunity for someone and something that keeps you going and gets you excited about working in this business.
So now we're going to ask the audience for some questions. Any questions? Yeah.
Would your lawyers let you tell us the first letter of the name?
No.
Saxenda. Saxenda.
But as I said, one of the metrics that we had from one of our Google campaigns was that we had an increase in Google AdWords search. So I'm sure you can use your Google.
You said you're working with third parties. Is it just in terms of marketing, or example, are you looking at social influencers, or are you working with individuals who have, like, let's say, healthcare apps that folks can use in terms of, managing, let's say, their weight loss, and maybe wanting to reach out to experts or industry experts to help sort of facilitate that?
Absolutely. So we do absolutely work with social influencers on content. Those social influencers we usually do a lot of research in advance because they have to have a like-minded view to obesity as we do. There is a healthy at every size movement that Novo Nordisk believes in and follows up until that point when we decide that that individual is not worthy of treatment because he or she is fine just the way they are. We part ways with that movement at that point because at that time we believe that those people deserve to be treated because obesity does lead to comorbidities that can be managed. I think that from a partnership perspective, we are open and willing and arms open to any kind of partnership. We've looked at, to name a few, like Noom, Weight Watchers, these types of really established apps. We've looked at other, positive weight loss programs that we've tried to partner with. So yeah, I think partnerships are really the future of this business because in order to effectively make change, these collective voices need to come together in terms of how we all go out to market, which is, yeah, definitely.
Thank you.
So you were saying that you created YouTube videos as part of your campaign, right? Yeah. I am someone who struggled with obesity for a long time. What would I need to search in order to get to that YouTube video?
So the videos we ran on digital networks, we don't have them posted anywhere. You can look up Novo Nordisk's website. That's the best thing I suggest to do, and you can check out our list of products, and then you can probably use your Google to go from there.
One more to that? Go ahead.
Hi, that was a really great presentation. Thank you for that. I wonder, in such a regulated environment, how do you target patient? Is it like a more broad targeting that you're doing, or a very specific targeting? How do you work that out?
So everybody creates a footprint. We can leverage that data to understand where those individuals go, and we can find them. What is really different about pharmaceuticals is that we can't retarget you. So if you click on something, if you say you click on an ad that we create, we can't retarget you with more information, but we can certainly find different areas. What other things that we may do is that we know if there's unfortunately, this 1 hour of medical school for doctors means that a lot of your doctors aren't prepared to have conversations with you about obesity if you wanted to have that conversation. So we know those who are, and sometimes we create more noise in areas where we know there is support. So where we know that there is a physician ready and willing and capable of managing a load of patients that are struggling, then we will target people in that region as well.
So I'm going to ask the last one, and it's an election year. Okay, so we're not allowed to tape this. It's an election year. Do you think that anything is going to, so to me, I've been hearing this story my entire career in pharma, right? They're old, they're legacy, they're holding back, and yet Americans do what they want, and we watch kind of progressions in other markets. Do you see anything on the radar, or what can we do as citizens? What can we do as citizens to make our voices heard? Because I love the idea that the government protects us. It also kind of angers me a little bit that I don't have the freedom of choice to be able to kind of get all the information that I need.
Yeah. So I guess the right answer there, and my opinion on this matter, is that pharmaceuticals are currently in the media quite a bit. There is a lot of talk of pricing reform within the Canadian environment and certain challenges and changes that are going to be happening in the pharmaceutical industry that may restrict the positive entry of new innovation in the pharmaceutical arena, which is certainly not something that we would want to see. So become informed, I think, is the first thing. Understand sort of what these issues are, and talk to your local politician about it.